Good morning, everyone. How you doing? Today is Saturday, April 25th, which is a day that we're all asking everyone to come outside and clean the front of their house. Today's Earth Day in the city of Bayonne. And this is our town, this is our city. And all we're asking is that everybody, not just today, but for going forward, let's just keep the front of our house and our curb line clean. It makes so much of a difference in our city when we can do that. It makes you feel so much better when you're walking down the street and you're not seeing garbage in the gutter. You're not seeing people's houses littered. You're not seeing dog waste in the way. So again, let's just try and keep that going, not just for today, but for every day. But everybody that participates today, I do want to say thank you. Make sure you send us our photos. Again, that's at mayors.office@baynj.org. Today, we're going to do, again, a little bit different. I have someone here who is right in the middle of this whole COVID-19 crisis. Someone who's near and dear to me. We have become such close friends over the last probably 5 years that we've been working together. Most importantly, over the last 3 months, every single day we have conversations to see how our community's doing, what more can we do for our community. And I'm talking about Dr. Singh from Bayonne Medical Center. And before I bring Dr. Singh out, I just want to say everything we are doing, everything you are doing with social distancing is working in our city. We are starting to flatten the curve. We're starting to see, the response calls slowing down, and this is where we need to be. But we still need to protect those who are the most vulnerable. So ladies and gentlemen, let me introduce to you my good friend, someone who's out there in the front lines protecting our city, Dr. Singh from Bayonne Medical Center.
Thank you, Mayor Davis. I would like to thank Mayor Davis for providing me with an opportunity to give updates from Bayonne Medical Center to our community. I represent the COVID warriors of CarePoint Health Bayonne Medical Center, and we are all Bayonne strong. CarePoint Health Bayonne Medical Center and our medical staff has been at the forefront of this battle against this epidemic with a mission to save precious lives in our community. Right from the onset of this pandemic, we have been collaborating with the New Jersey Department of Health, New Jersey OEM, Mayor Davis, Bayonne OEM to manage the constant needs arising out of this pandemic, as well as create an effective and transparent process for our community. CarePoint Health Bayonne Medical Center has proven once again that it is the only full-service acute care hospital in the city of Bayonne which is equipped to handle all the medical emergencies of the community. Since the pandemic began, we have tested over 1,100 patients with 586 positive cases and 338 Bayonne residents. We have treated and released over 300 PUI patients home from our emergency department and discharged an average of 5 COVID-positive patients home to their loved ones every day. We have left no resource untapped in our efforts to provide critical care to the patients in our community by doubling the number of ICU beds, repurposing floors to add capacity, hiring additional critical care and general nurses, and by adding capacity to our emergency room by creating a surge tent for triage. Additionally, we have used all available therapeutics, including frontline IL-6 inhibitors and antiretroviral medications, and are now starting convalescent plasma therapy infusions, as well as plasma donation drive in collaboration with the Mayo Clinic and the American Red Cross. We continue to conduct our drive-through testing for the symptomatic Bayonne residents to keep the community transmission of this virus under control. Under the excellent and resourceful leadership of Commissioner Perry Shelley and our partners at New Jersey Health Association, we have been working closely with the New Jersey Department of Health and FEMA to mitigate the urgent needs with ventilators and PPE, as well as coordinate with all Northern Region hospitals by patient referrals to the field medical station in Secaucus, as well as USNS Comfort. In closing, as the Chief Hospital Executive of Bayonne Medical Center, I would like to thank Mayor Davis, Jr. and the Bayonne Office of OEM, Madam Council President and the entire City Council, Chief Geisler of Bayonne Police Department, Chief Fever and the Bayonne Fire Department, Chief Mike McCabe and McCabe Ambulances, all the members of Bayonne Chamber of Commerce for that unrelenting support to our staff, patients, and the community. Additionally, A big thank you to the entire Bayonne community for following the recommendations that Mayor Davis has just laid out for social distancing, and for businesses for supporting our staff with your donations, which are a reflection of your love and respect for everyone at the hospital. Thank you, and God bless everybody.
To everyone in Bayonne, I just want to thank Dr. Singh coming straight here from the hospital just to talk to the people of Bayonne and maybe to let them understand a little more that it's not just coming from the political people, but this is for everybody. And what I want to say on behalf of everyone in Bayonne, that we want to thank all the doctors, all the nurses, all the first responders, McCabe's people, Bayonne Fire Department, Bayonne Police Department, and everybody else. You know, there's so much going on in this city right now that it's not just first responders. You know, we are actually feeding this community. You know, if there's something out there that you need, if you need food, reach out to my office. Our council president, Sharon Nadrowski, is working with other groups, with BEOF and Stephanie Wilson to get everybody what they need. And we will not stop until we have basically have eradicated this from our city. So as the mayor and on behalf of the council, I just want to thank everyone that is putting time out to help each other, because that's what we do here in Bayonne. So please, let's continue the social distancing. Let's get through this. I really believe in a couple more weeks, we're going to see such drastic numbers that, you know what, we're going to start seeing that resemblance of our normal life can start coming back together for us. So thank you very much and take care.